What precautions should I take after the embryo transfer? One of the commonest questions patients ask is, "Doctor, what are the do's and don'ts after the embryo transfer?" They are very worried about the risk of failure, and are petrified that they may end up doing something which will cause their embryos to fall out of the uterus. Many will often spend the entire 2-week wait obsessing about their diet and physical activity. Many studies have proven this conclusively. The human body has been designed with enough sense that embryos do not fall out if you cough or sneeze. The truth is that human reproduction is inefficient and we cannot control the outcome. Whether the embryo implants or not is a biological process which the patient cannot influence in any way. Once the embryos have been transferred into the uterus, they are safe and cannot fall out. This is simple common sense. IVF embryos, once they have reached the uterus, do not remember that they have spent 3 days in an IVF incubator. They are just like all other in vivo embryos which are formed after intercourse in the bedroom. Whether the embryo spends 3 days in your fallopian tube or in a test tube makes no difference to the outcome. A word of advice to spouses. You are very likely to be overprotective during the 2-week waiting period. You will want her to rest and take things easy. You will tell her not to go to work, or to be very careful as to what she drinks or eats. Actually, this bed rest can be harmful, and we do our best to encourage our patients to go back to work after the embryo transfer. Keeping yourself gainfully occupied is your best bet. Sitting at home, when you are well, can be very demoralizing. It can be very hard to deal with the uncertainty and anxiety of the 2-week wait. The emotional stress is enormous, and lying in bed all day just exacerbates this 1,000-fold. Patients on bed rest tend to brood all day long about the outcome. Every minor twinge and ache is magnified, and your mind plays games with you during the 2-week wait, and common sense suggests this stress cannot be good for you. You cannot influence the outcome, all you can do is gracefully let nature take its own course. Need help getting pregnant? Send us your details at www.drmalpani.com/free second opinion,